Okay, as you all know, I intern at the emergency room in St. Joseph's Hospital, and this video will show you how the emergency room operates on a daily basis. When patients arrive in the emergency room, they check in, then wait in the lobby as you see here. Patients' information is then printed out, and a nurse calls them into the triage room. In the triage room, the nurse takes and records all vital signs. Next, the nurse will ask what is wrong with them and how long they have been in pain. The nurses then have to decide the severity of the situation and also record the patient's pain level from 0 to 10, 10 being the worst pain they've ever felt. Nurses then refer to the severity chart to determine what level they should be categorized as. The chart has 5 different areas to place the patients, red being critical and blue and green as express patients. Once the nurse determines where the patient needs to be placed, the nurse will put the patient's information into the proper colored chart and then take them to their room. Another way patients get to the emergency room is by ambulance. In the ER, there are 3 phones that only ring when an ambulance is on the way, telling how severe the patient's condition is and to clear a room for them. The patient who is brought by ambulance will be wheeled in from this area, or from the other side, which is also known as the ambulance bay area. This entrance is strictly for ambulance use, and each EMT will have to type in a code to open the sliding doors. In the indoor bay area, there is always extra supplies, such as these backboards. And this is the entrance view from inside of the emergency room. Once a patient is assigned to a room, they quickly get connected to the monitor, which will display their heart rate, respiration, pulse, and takes a new blood pressure automatically every 30 minutes. Once a patient is connected to the monitor, the information is then displayed on the main monitor, which can easily be viewed by nurses and doctors. The patient will then get connected to the EKG machine so the nurses and doctors can tell if there are any abnormal ticks in the heart's rhythm. Another machine that might be ordered is the ultrasound machine, or, in severe cases, the ventilator, or the life support machine. The doctor writes his orders on the patient's chart, and when medication orders are given, the nurses have to type in their username and passcode to open these drawers on the left. Then they have to count how many vials are left and type in the number to prevent stealing of the medication. Doctors might order the need of certain supplies, and this is one of the walls in the supply closet. In this room, there are extra catheters in many different sizes. This area has supplies that are used if someone has a broken bone. Here is the other half, and it is known as the ortho cart. This next device is called the tube system and is used to send samples containing urine, stool, and blood down to the lab. Here on the left is the warmer, which stores warm blankets, and the rest of the things on the right side are extra gowns, sheets, and towels. This room in particular is a psych room, used to obtain psychiatric patients. It's bare on purpose so patients won't harm themselves or others. In the express care, there are express rooms. This one in particular was getting set up for a pelvic exam. Here are the supplies that were getting prepared by a nurse for the procedure. And here is another lovely view of that bed. This is the intubation bag, which is used when a code blue is announced on the speakers. The closest nurse and doctor to the bag when the alarm goes off grabs the bag and runs to where assistance is needed. This is what the basic nurse's station looks like. Each nurse has a computer and some space to chart, and for the nurses to write up the patient's discharge papers. And finally, the patient is taken to the discharge desk, checks out, and hopefully begins to feel better soon. But that was the basis of how the emergency room operates. Hope you enjoyed it. Bye.